A series of typhoons and tropical storms have hit the Philippines since late September. More than 1,000 people have died. Tens of thousands of homes were destroyed and hundreds of thousands of families have been displaced. Homeless, they are now living in overcrowded evacuation centres or with friends and family. On October the 30th, another typhoon hit the outskirts of the capital Manila, prompting MSF to set up another project.
MSF is here to provide emergency aid. We're distributing essential items as well as medical care. We're also building showers and latrines so that people have easier access to hygiene facilities.
The teams are also checking on people who have stayed in their partially flooded homes and who find it harder to access medical and material aid. During these mobile clinics, patients are treated mainly for respiratory infections, skin diseases and diarrhea. Medical staff are monitoring the spread of the leptospirosis epidemic. Over 3 million people have already been infected in 6 weeks, primarily in the Manila region.
Leptospirosis is transferred mostly by the stools of rats and the urine. So in this kind of water there are a lot of rats, and it's very easily to transmit to the people, because usually the people here who work, the skin is not well, they have many lesions, they have fungosis, so it's not in a good condition and can easily go inside the body and provoke the disease.
Typhoons also hit the northern Philippines, including the island of Luzon, where in some areas everything was literally torn down. Since early October, Médecins Sans Frontières teams have carried out more than 4,000 medical consultations across the country. They have also distributed essential items, such as blankets and jerry cans, to approximately 20,000 families. MSF staff load 200 sleeping bags, pairs of gloves and backpacks due to be distributed to Afghan migrants. There are several hundred Afghans living on the streets in France. As winter approaches, their situation is increasingly difficult. Several organisations decided to set up a distribution of winter kits in Paris and Calais on Tuesday, November the 10th. MSF carried out the distribution together with 2 other charity organisations at a park in central Paris where most of the Afghan migrants gather.
I'm slip the road, everything, because too many problems. I'm slip the road. I'm too happy. Somebody help me.
Some of the Afghan migrants are minors. Many are seeking asylum. Living on the street and in the cold, they're exposed to a host of health and sanitary problems.
Obviously, sleeping outside can cause health problems. A simple cold can easily develop into a respiratory infection, for example. And then, of course, there's the risk of flu. They sleep close together, trying to keep warm. They share sleeping bags. And there aren't enough showers available to them, so it's harder for them to wash, and in particular to wash their clothes and sleeping bags. This creates a risk of skin infections, which are often contagious, scabies in particular.
After the distribution, MSF gave the youngest migrants coats to help ward off the cold. However, these distributions are just temporary measures. MSF and all the other organisations have called on the government to take emergency measures and provide shelter. With World AIDS Day approaching, MSF sounds the alarm. After 10 years of increasingly significant mobilisation, the international community appears to be pulling back on its financial commitment. These are troubling signs, and come just at a time when medical teams are seeing progress in the field.
This level of funding for HIV treatment must be maintained, or even increased, as only 3 out of 10 people in need of treatment are receiving it.
The 2 key sources of funding are the US program PEPFAR and the Global Fund. Both institutions are considering freezing, reducing or possibly reallocating funding to fight other diseases.
We are starting to see signs of this in various countries, with drug supply shortages. This year, on our program in Malawi, for example, the French section has had to pay an extra 300,000 euros from its own funds because treatments had run out for our patients.
Funding issues aside, HIV/AIDS remains a major health problem. To make real progress in this area, people need to be screened and put on treatment earlier. New and more effective medicines have to be developed, and patient follow-up needs to be simplified. Tuberculosis may be a neglected, forgotten disease, but it's far from eradicated. Every year it kills 1.7 million people. A Médecins Sans Frontières report highlights the fact that European countries do not consider the fight against TB a priority. The Campaign for Access to Essential Medicines and the International Union Against Tuberculosis and Lung Disease met in Stockholm in October. The objective was to alert governments to the importance of research in this area.
What has changed is that we are in a particular moment where, with this new technology, if we were to be able to finance this new technology, we would be about to provide or be delivered good and adapted and affordable diagnostic and treatment tools, and maybe also one day good vaccines.
The figures are clear. 1.5 billion euros needs to be invested in TB research. So far, a mere quarter of that sum has been allocated. In Europe, mainly Eastern Europe, 500,000 new cases are diagnosed every year. However, diagnostic tools and treatments are out of date and often ineffective. And the appearance of new resistant strains is an additional hurdle for medical teams. What is Médecins Sans Frontières' role in medical innovation? A new publication provides answers. Medical innovation in humanitarian situations is the result of collaboration between a group of doctors and sociologists. 5 diseases are discussed in this book: cholera, meningitis, human African trypanosomiasis, malaria and AIDS. Through them, it illustrates how MSF's activities in the field have helped medical practices to evolve.
We're often confronted with situations where either we resign ourselves to ineffective actions because we lack the appropriate resources, or we take the risk of innovating and perhaps even failing.
The study disproves the notion that humanitarian medicine is limited to recycling of methods and tools. On the contrary, innovation is crucial to fighting diseases that university and pharmaceutical company research often neglects. Innovation requires a professional organization capable of adapting treatment to local situations.
Innovation also involves introducing relatively new medicines in settings where their use was not anticipated, and adapting their protocols so that they can be used in situations where we work. I'm thinking, for example, like when we introduced antiretroviral drugs to treat AIDS in Africa.
Indeed, many aspects of our work do in fact contribute to improving effective care and treatment, despite MSF working in precarious situations. We dedicate this month in focus to 2 colleagues. Yahya Mosfer Alfarah had been working for MSF as a driver since January 2009. He died on the night of October the 12th in Yemen when a bomb struck his house. Riaz Ahmed Khalil was also a driver for the organization and had been working for MSF since July. He was killed in Pakistan on September the 26th during an explosion in the market in Peshawar. All colleagues and Médecins Sans Frontières members joined together in paying tribute to Yahya and Riaz.